This is my fist. Now if everybody else could please hold up your own fist and look at it. It's not that big, pretty small. Now your heart is approximately as big as your fist. Imagine an organ this small, doing so much, keeping something this big up and running every single day of every day you've been alive. It's amazing, isn't it? This is just the beginning of my love for this magnificent field. In fact, on my first research interview, the doctor I was interviewing commented, "I didn't know someone's eyes could get that big." He was referring to my expression when he offered to let me see some surgery. So you could say that I was absolutely elated by this offer. My love for this field and the passion I have for opportunities like this is exactly what's driven me forward and made me so certain what I want to do with my life. Since I was a child, I knew that the field of medicine would be a major part of my life, but little did I know just how much it would shape me to be the person I am today, standing in front of you. My name is Shriya Reddy, and I'm studying cardiovascular surgery this year in ISM. To start off, I'm going to tell you what exactly my topic of study is. Cardiovascular surgery is surgery of all of the arteries and blood vessels of the heart. In close correlation is cardiothoracic surgery, which is surgery of all of the organs of the thoracic cavity, including the heart, diaphragm, lungs, esophagus, etc. However, I knew that I wanted to focus only on the heart, therefore bringing me to my choice of cardiovascular surgery. Now, you may be wondering, how did you choose cardiovascular surgery out of all the endless aspects of the medical field? Well, this field combines two of my main interests, the heart and surgery. In every science course I've taken, the cardiovascular unit, the heart unit, was always my most favorite one of the entire year. And as for surgery, the idea just simply always excited me. Last year in anatomy and physiology, the cat dissection unit was probably my favorite experience from the entire year. So in the end, the heart and surgery combined brought me to the constantly evolving, always exciting field of cardiovascular surgery. Now, equally if not more important than research were the interviews I've been on. I've been on 5 research interviews this year: Dr. Brinkman, Dr. Homan, Dr. Moore, Dr. Bayona, and Dr. Lytle. All of these surgeons are cardiothoracic surgeons except for Dr. Homan, who is a vascular surgeon. A vascular surgeon operates on all of the arteries and blood vessels of the entire body except those on and around the heart. Despite Dr. Homan not being in the field I was studying this year, nevertheless went on my interview with him and gained so much experience. It was definitely a good choice of the year. On my interview with Dr. Homan, I had gotten a tour of the clinic, met a patient, understood the patient's condition, sat in on an ultrasound, interviewed Dr. Homan, and watched 2 arteriovenous grafts along with an emergency stent procedure. As for my mentorship, however, I requested Dr. Moore, who is sitting right here in our room. He's a cardiothoracic surgeon at the Baylor Heart Hospital of Plano, and I felt that out of my 4 remaining interviews with cardiac surgeons, Dr. Moore showed me his immense amount of passion and dedication for the field, and I felt that he would be the one to give me the most in a mentor-mentee relationship. Dr. Moore thankfully accepted my offer, and I'm now his mentee and he is my mentor. A little bit about Dr. Moore is that he completed his undergraduate studies at Louisiana Tech University, followed by medical school at the Louisiana State University School of Medicine. He then furthered his medical studies at the University of Mississippi School of Medicine and the Medical College of Georgia. With almost 10 key publications and over 5 clinical trials conducted in the past years, Dr. Moore is an experienced and influential cardiac surgeon currently at the Heart Hospital of Baylor, Plano. Dr. Moore has been such a great mentor to me throughout this year. He introduced me to the field with patience and understanding and always made sure that I followed along with everything he said and was doing. He took the time to walk me through everything and also gave me countless on-hand experiences. Moving on though, my research this year is something I've learned a lot from. As you can see here, there are 8 points, and these 8 key points are the 8 focus points for my research. Every research assessment I've done and every evidence of learning assessment I've done, I've always tried to connect back to one or more of these 8 key points, which are a cardiovascular surgeon's typical work life, technology's effects on this field, professional research, clinical trials, demographics of heart problems, evaluating heart disease and stroke as the leading cause of death, differences of the cardiovascular system in varying groups of people, and recent advancements in cardiovascular procedures. As for one of the assessments I did this year, it was about migraines and stroke and the relationship between the two. This assessment was a major part of my inspiration for my original work this year. So a little bit about the article that I read. I read that there was a link between migraines and stroke, showing that women who suffered from migraines also experienced more than double the risk of getting a stroke or a heart attack. With this, I realized how there are so many risk factors and so little knowledge. Over 1 million people, 1.1 to be exact, die of a heart attack every year. Even more alarming is that 47% of sudden cardiac deaths occur outside of the hospital, meaning that those affected, almost half of them don't take immediate action on the early warning signs. With the services and technology we have in today's time, I found it extremely unsettling that the signs of a heart attack are not taken seriously at all. On top of this, I've personally known multiple people that have suffered from a heart attack. In fact, my most recent encounter with this situation was this past December, when someone my family knew had passed away from a heart attack. It was an unexpected event and no one saw it coming, or so they thought. He'd actually been having chest pains for the past 3 days before his death, and everyone, including himself, pushed it aside as maybe a heartburn or something of no concern. I found this disturbing to see that despite having the signs of a heart attack, chest pain being one of the most indicating factors of a heart attack, never did it occur that he might have actually been having one. This and many other events greatly inspired me to go forward with the following idea for my first major project this year, my original work. I thought about how often this happens and asked myself, But first, what exactly is a myocardial infarction? A myocardial infarction, otherwise known as a heart attack, is when the heart receives decreased oxygen and blood due to blockage of the coronary arteries. This blockage comes about due to a narrowing of the artery, due to plaque buildup and cholesterol buildup, and blood clots getting stuck in the artery. Heart attack is actually the leading cause of death for both men and women, and risk for heart attacks increases with age. It's also been found that African Americans are at a much greater risk as compared to the general U.S. population, and that lower socioeconomic levels also show greater risk as well. So the fundamental question of this report came to be, how common is it to be at risk for a heart attack? How much awareness does the public really hold on heart attack signs? The first half of the survey assesses the participants' own risk for a heart attack based on multiple factors like sex, age, race, stress levels, physical activity, diet, and family history. The second half of the survey tests the participants' understanding of the signs of a heart attack or their awareness. This was assessed through a quiz-like format with multiple choice questions and true-false questions. There were a total of 19 questions, and I was able to cover most age ranges and races, providing me with a sound covering of the general public. Over the course of 5 days, I received a total of 130 responses, allowing me to get a closer to accurate summary of the results through the large participant numbers. As you can see here, I have a couple of the questions from the survey and the results of what everyone chose as the right answer. So this is where I would usually talk about each picture from the survey and results and ask the audience what they would choose and kind of talk a little bit about their choices, why they would make the choices, everything of the sort. This would probably take around 5 minutes. So after that part, I'm going to go on to the next part of my speech. After having gone through the entire survey, 2 points had become evident. Firstly, that it's quite common to be at risk for a heart attack, with risk factors like hypertension, high cholesterol, diabetes, etc., becoming increasingly common in our world. Secondly, that the public is not educated enough on heart attacks, and its signs and symptoms and awareness needs to be spread. What can we do about this is now the pressing question. Our lifestyle has drastically changed over the course of the past few decades. Everything has become about work and money, and stress levels have greatly risen. Our lifestyle has overall taken on a lower quality of life as everything becomes about materialistic things. And I can say that we are all subject to this confession. To start off, people aren't taking care of themselves in ways that they should, but fortunately this can be changed. For example, changes in diet can make a great difference, and it's something that is easily able to be done. Eating foods high in fiber and omega acids, excuse me, eating foods high in fiber and omega acids and low in fat and sodium could drastically improve your health. In addition to diet, we can work on physical activity. It is recommended to engage in 45 minutes of physical activity, rigorous physical activity every week, or 150 minutes of moderate physical activity every week. As for raising awareness, the question, what is it, will then be, what do we do? And the desire to know what to do will grow. Knowing myocardial infarctions in their entirety will prove to be of great benefit to the people, a people in which nearly half of all sudden cardiac deaths occur outside of the hospital due to missed chances, or more so, lack of awareness in how to act in a situation. Myocardial infarctions are becoming increasingly common, and the chances taken into our own hands to the best of our abilities should push the public to attack this problem through their own lifestyle changes, as well as increase awareness in the general public. So that's just a little bit of a summary of my original work. Moving on to my final product. I read an article that greatly inspired me to go forward with the idea for my final product. A little bit about the article is about rheumatic heart disease and a transcatheter aortic valve implantation device that was invented to help the problem. Basically, this replacement method offers hope for the thousands of patients with rheumatic heart disease who need the procedure every year. Transcatheter aortic valve implantation only applies to patients with calcific degenerative aortic valve disease, which is quite common in developing countries, but more commonly found, especially in developing countries, is rheumatic heart disease. You're probably wondering, what exactly is rheumatic heart disease? RHD, or rheumatic heart disease, is caused by rheumatic fever, which results from a streptococcal infection. Patients develop fibrosis of the heart valves, leading to valvular heart disease, heart failure, and possibly eventually death. Inspired from the success of TAVI for calcific degenerative aortic valve disease patients, the European Society of Cardiology developed a similar TAVI for patients with rheumatic heart disease. This modified TAVI implantation device doesn't need to stop blood flow to the heart through rapid ventricular pacing, meaning it's non-occlusive, like the TAVI for calcific degenerative aortic valve disease is. Additionally, the new device doesn't need advanced cardiac imaging to position it. Rather, it's self-locating, therefore allowing this procedure to be done in developing countries where there are hospitals that don't usually have surgical departments or even a cardiac surgical department. So as for the second major product this year, my final product, my mentor's own efforts with the Pacific Islands Medical Aid Organization, which I'll talk a little bit more about in a bit, and this article I read about a novel heart valve replacement method for rheumatic heart disease patients inspired me to go forward with the following idea. Before I tell you what exactly my idea is, let me give you a little bit of background on rheumatic heart disease. According to the World Heart Federation, RHD affects 15.6 million people, especially children and young adults in low-income countries, and it kills around 233,000 people annually. RHD is almost entirely concentrated in the developing world, especially Africa, India, Indonesia, and other Pacific islands. The Pacific is one of the worst affected areas by RHD. Dr. Moore partakes in a nonprofit organization called the Pacific Islands Medical Aid, or PIMA, which has been very prevalent in providing medical aid to the Pacific, especially the Republic of Kiribati, The Republic of Kiribati is made up of 33 islands spanning 2,000 miles along the equator with a population of around 100,000 people. Kiribati is occupied by those of Micronesian descent speaking the Oceanian language. It's an immensely underdeveloped country considering its isolation from the rest of the world. Many live in open shelters with no running waters, much less electricity and technology. So what PIMA does is they provide basic surgical care, obstetrics and gynecology, ophthalmology, as well as cardiology, and just general health care that we can provide in developing areas like this. So with Dr. Moore having his own special interest in RHD and putting his time into this product, I decided that my product centering around this idea will provide me with a truly educational experience from which I can learn a lot. So for my final product, I decided to create a website regarding and raising awareness about PIMA, heart attacks, and PIMA and rheumatic heart disease. The current program focuses on identifying severe RHD patients in need of surgical care and providing echo screening in schools for those who might have been at risk for or have suffered from streptococcal infection, since that does put them at risk for RHD. So throughout this product, I decided to research the following questions, which are: what is rheumatic heart disease? Who does it affect and why? What are the predisposing factors and signs and symptoms of RHD? What is Pacific Islands Medical Aid's role in taking on RHD in the Pacific, specifically Kiribati? What are the different ways RHD can affect someone? What are the respective surgical treatments explained in detail? What are the preventive measures for RHD? Other than mass screening, what else can be done to prevent repeated streptococcal infection episodes in the long run and overall lower the rates of RHD? Through this project, I was exposed to the etiology, possible outcomes, possible risk factors, surgical procedures, anything and everything that could be related to and I could learn from regarding rheumatic heart disease. Overall, this project allowed me to utilize skills and research both from my mentor and my own studies. Here you can see a couple pictures from my website in each tab. So this is where I would talk about each tab of my website, going through each picture on the slides. My presentation is set up next to the computer, and I couldn't get it in the video since it was against the wall. But I have pictures of my website, and I have stuff decided for what I will say, and as soon as I finish my product, I will have more to say about that. So this part of the speech will probably take around 5 minutes too. Moving on to my conclusion. Throughout this year, I've gained a multitude of skills that I'm thankful to have been exposed to. I've become much more familiar with understanding heart scans such as echoes. Dr. Moore and I, every mentor visit, we would always go through echocardiographs of the patients he'd treated the past week, and I would be able to understand it, analyze it, learn how to read it specifically. Also, I actually understand the terms Dr. Moore uses now, because honestly, at the beginning of this year, I was quite lost. And Dr. Moore, of course, saw this and made sure I understood everything he was saying, always made sure I followed along with everything. I've also become more accustomed to watching surgeries and just overall hospital setting. Dr. Moore helped me follow along with each step of the surgeries I watched, and with my own original work and final product, I've been able to advance my research and overall knowledge about the field. One of my favorite experiences from this year was when I observed a coronary artery bypass graft surgery as Dr. Moore's case. A coronary artery bypass graft surgery is basically when the heart's blood flow is obstructed due to plaque buildup. So we'll take a vein or an artery from another part of the body and basically bypass it, so change the route of the blood flow so it can go through a much cleaner artery and overall increase the quality of blood flow in the heart. So I was able to stand at the head of the patient's bed with the anesthesiologist. If I was right here, the heart was maybe 2 feet away from me, super close to it, and I got to observe every step of it, starting from when they made the incision into the patient's skin, to when they sawed open the sternum. I saw the actual heart beating, to when they made the heart cold and lowered blood flow to the heart, all the way up to when they stitched every layer of the skin back up. I enjoyed every single minute of the 6 hours that I watched the surgery, and Dr. Moore made sure that I was following along the entire time, and I honestly learned so much. Seeing a live heart up close opened my eyes to the wonders of the human heart, and helped me better understand heart functions and how it can be affected. But I wouldn't have even been able to do a fraction of the work I've done this year without the help and support of a few people. First of all, I'd like to start off by thanking my parents for having so much faith in me throughout my entire life, never once doubting my dreams. I'd like to thank Dr. Moore, my wonderful mentor, for teaching me about this field and always showing me patience and understanding, no matter how confused or lost I could have been. Thank you for understanding me and always being willing to expose me to as much as possible, Dr. Moore. You've inspired me to take on my dream and with even more determination, and I'll always be grateful to you for being my mentor and always being there for me when I needed someone to teach me. Lastly, but not least, I'd like to thank Mr. Wysong. Mr. Wysong has consistently believed in me even when I didn't give him reason to believe in me. He has confidence in what I'm capable of and has motivated me to be more than what I think I can be. Without Mr. Wysong, I would not be standing here in front of all of you. He inspires me to be the best I can be, and I will forever be thankful for my relationship with him. I assume